We have a safety alert for most people. The COVID-19 vaccine had no side effects, but for some people, it actually did have some side effects, and they were long-lasting. Yale researchers just released these findings on a condition known as post-vaccination syndrome, or PVS. These are people who have had side effects to the COVID-19 vaccine. So to talk about this more, I'm here with family doctor Bijoor to discuss exactly what this means, what it was entailed in this study. So thank you for joining us today.
Thank you for having me.
Let's first start with what the symptoms are of PVS. I think it's something I haven't heard of before. So what is post-vaccination syndrome?
So what we're finding is a group of symptoms that we're seeing in people that have received the vaccination. Symptoms can range from mild to severe. This is a new area of research, so as things are emerging, we're finding out, but mostly symptoms like fever, chills, some fatigue that lasts weeks to months to a long time, joint pain, diffuse joint pain, headaches, also some nausea, gastrointestinal symptoms like constipation, diarrhea for unexplained reasons, neurological symptoms like dizziness, brain fog, and even some neuropathies and numbness in hands and feet, and also myalgia, which is muscle tenderness and just muscle achiness. So we're realizing that these symptoms are not really fitting. It's challenging to diagnose because they don't really fit one clinical scenario, and of course we must exclude other medical conditions. Generally symptoms are mild, they're not life-threatening, but they can affect the quality of life. So,
have you seen patients with these symptoms?
Absolutely. I've seen patients, and several of our physicians have also experienced such symptoms because this happened in a matter of months where people were dying, and a lot of us got COVID, but then the vaccinations were developed. So we're really trying to understand. But for the majority of the symptoms in the patients we're seeing, it's fatigue, joint pain, and neuropathy. I would say that's kind of the majority of symptoms.
Is it a certain age group? Are they older, younger, anybody? Or?
I'm not seeing, I don't know, whether it's any specific age group, but I would say some in conditions, people that have other chronic conditions. I think it links back to the immune system because vaccines challenge our immunity. So those of us that have a hyperimmune response are seeing the manifestation in other systems of our body.
So let's talk about that study. What did the study find?
So the study interestingly found that, it's not, although we kind of started looking at it because of the COVID vaccination, they realized that it could be linked to other vaccinations like the flu vaccine, the hepatitis B vaccine. It showed that it's possibly linked to the lower white blood cells, immune system again, and higher levels of certain proteins in the patient's system. And the other thing that we found is, although it seems like there's a significant number of patients that are having these symptoms, on a global scale, when billions of people receive the vaccine, that percentage may not be that large in terms of global numbers, but still a growing body of research and is needed to understand this.
So when someone is trying to decide, should I take a vaccine, how do they go about that process? If they're thinking, hey, I had these long-term side effects from the COVID vaccine, how do they go about that conversation of should I take a different vaccine?
Right. I think it's a really important conversation to have with your physician, with your provider. We are trying to understand the magnitude of these symptoms, the long-term complications and implications of these symptoms. So it's really a discussion to have, and it's more of a personalized approach, And for us as physicians to be non-judgmental is really important, and to understand each patient's unique scenario and whether vaccination, it's all about risk versus benefit. So we have to make that educated decision with shared clinical decision making, because on a global level, vaccines, it's a public health tool, and it's very important to have safe and effective vaccinations. So when we find people are having symptoms after vaccinations, it's really important to have that discussion and keep an open dialogue as we learn more, as physicians get together and talk about it more as well. So,
all right. Well, thank you so much for joining us and covering that topic. I think it's something we haven't discussed very much before, so it's very interesting information.
Yeah, I think.
All right.